Let me get straight to the point before I explain anything else. Here's the one-line answer you came for. Daily pelvic floor exercises, specifically Kegels combined with diaphragmatic breathing, done consistently for at least 4 weeks, is the single most effective drug-free method to improve erectile firmness, perceived size, and staying power. Everything I'm about to share builds on that foundation. I'm Dr. Grace Holloway. I've been practicing urology for over 20 years, and I've worked with thousands of men in their 50s, 60s, 70s, who came into my office quietly frustrated, a little embarrassed, and honestly convinced that what they were experiencing was just the end of the road. Inevitable, irreversible, just part of getting older. I'm here to tell you it doesn't have to be. Now, before we go any further, I want to ask you something. Have you noticed changes in firmness, in fullness, maybe even in how things look down there? And have you quietly wondered whether there's anything you can actually do about it, without a prescription, without a procedure, without having to sit across from someone and spell it all out? If that's you, you're in the right place. And I promise, no fluff, no filler, just real clinical information that you can start using today. Let's talk about what's actually happening inside your body. When men age, several things shift simultaneously. Blood vessels lose elasticity and gradually stiffen. Testosterone levels, your primary male hormone, decline slowly but steadily. And here's the part that almost nobody talks about, even though it's critically important: your pelvic floor muscles weaken. Most men have never even thought about these muscles. But in my 2 decades of practice, I can tell you that pelvic floor weakness is one of the most underdiagnosed contributors to erectile changes in men over 50. These muscles aren't just about bladder control. They form a deep structural support system that directly influences erectile function. And within that system, 2 specific muscles do the heavy lifting: the bulbocavernosus muscle and the ischiocavernosus muscle. If you've never heard those names, don't worry, most men haven't. But I want you to remember them, because understanding what they do changes everything. The bulbocavernosus muscle plays a critical role during sexual arousal. It compresses the deep dorsal vein of the penis, trapping blood inside the erectile tissue and helping maintain that firmness. The ischiocavernosus muscle works alongside it, intensifying that internal pressure and contributing to the upward angle that many men associate with their younger years. Together, these 2 muscles act like a biological pressure valve. When they're strong and coordinated, blood stays where it needs to stay. When they're weak, and they do weaken with age, with prolonged sitting, with sedentary lifestyle, with prostate-related issues, blood escapes too easily. The result is erections that feel softer, shorter, and less reliable than they used to. That's not a failure of desire. That's a mechanical problem with a mechanical solution. So here's exactly what you need to do, and I'm giving you this now, up front, not buried at the end of a 14-minute video. The exercise is called pelvic floor muscle training, or PFMT. You might also know part of it as Kegel exercises, though what I'm going to describe is more comprehensive than the basic version most people have heard of. Start by finding the right muscle. The easiest way to do this, and this is a one-time identification technique, not a regular practice, is to try stopping the flow of urine midstream. Don't squeeze your thighs. Don't hold your breath. The muscle that engages when you do that, that's part of your pelvic floor. That's what you're training. Once you've identified it, move your practice somewhere comfortable, sitting in a chair, lying on your back, even standing. All of these work. Take a few normal, relaxed breaths first. Then, using that same internal lifting and squeezing sensation, gently contract the pelvic floor muscles. Imagine you're picking something up from the inside or trying to stop that flow again, but without any tension in your belly, your thighs, or your chest. If you feel tension anywhere else, release and refocus. Hold the contraction for 3 to 5 seconds, then fully release for 5 seconds. That release is just as important as the squeeze. Don't rush it. As you get stronger over the coming weeks, you can extend the hold to 10 seconds, but do not sacrifice quality for duration. A clean, isolated 5-second contraction is worth more than a sloppy 10-second one where you're recruiting half your lower body. Do 2 to 3 sets of 10 repetitions per day. You don't have to do all of them at once. Morning when you wake up, afternoon during a break, evening before bed. Spread them out. This takes about 3 minutes total. 3 minutes. That's it. No gym, no equipment, no awkward conversations at the front desk. Pair each contraction with your breath. Exhale slowly as you squeeze, inhale as you release. This diaphragmatic breathing component amplifies the effect by reducing intra-abdominal pressure and improving neuromuscular coordination in the pelvic region. It sounds technical, but in practice it just means breathe out when you squeeze, breathe in when you let go. Now let me show you what the research actually says about this. A randomized controlled trial targeting men over 60, men just like many of you watching right now, examined what happened when participants with mild to moderate erectile dysfunction followed a structured pelvic floor training program for 6 months. The results were significant. More than 40% of participants fully recovered normal erectile function. An additional 35% reported measurable improvements in firmness, control, or sexual satisfaction. That means over 3/4 of the men in this study experienced meaningful, positive change. Without a single pill, without injections, without surgical intervention, just targeted muscle training. I've seen these numbers play out in my own practice. I've had patients in their late 60s come back after 10 weeks and tell me things are different. Not magically transformed, but genuinely, noticeably better. More reliable, more confident, more like what they remembered. The mechanism behind these results comes down to a concept called venous occlusion. When the bulbocavernosus and ischiocavernosus muscles are strong and well coordinated, they compress the venous drainage system around the base of the penis. This creates sustained internal pressure that keeps blood trapped in the erectile tissue longer. The result is firmer, fuller, more lasting erections. But here's something important that doesn't get talked about enough, especially for men over 60. It's not just raw muscle strength that matters, it's neuromuscular control. The brain's ability to activate the right muscles quickly and precisely at the right moment. Think of it like the difference between having strong hands and having fast, accurate hands. Both matter. This is where biofeedback comes in, and I want to spend a moment on this because it's a game changer for some men. Biofeedback is a training method that gives you real-time information about what your pelvic floor is doing. Using soft sensors, clinical tools, or even guided apps, you can actually see or feel when you're contracting correctly, and just as importantly, when you're not. For men who've struggled to isolate these muscles or who aren't sure if they're doing it right, biofeedback dramatically shortens the learning curve. It reduces frustration. It builds confidence faster. That said, and this is important, you don't need biofeedback to see results. Plenty of men in my practice have made tremendous progress through consistent daily practice alone. Biofeedback is a tool, not a requirement. If you've tried this before and weren't sure if you were doing it correctly, that uncertainty is completely normal. You're not alone in that. Just start with the basics I described. Stay consistent, and you'll develop that connection over time. Now, I want to talk about something that comes up constantly in my consultations, and it's something I know a lot of you are wondering about, but maybe haven't asked directly. The question of size. Many men over 50 feel like things have gotten smaller. That perception is real. The frustration is real. But here's what the anatomy actually tells us. The physical dimensions of penile tissue don't shrink with age. What changes is the quality and completeness of erections. When pelvic floor muscles are weak and venous occlusion is compromised, blood doesn't fill the erectile tissue fully. The erection is partial, softer, less pressurized, and as a result, it appears and feels smaller. This is what we call perceived size, and it's directly tied to erectile quality, not anatomy. This means that pelvic floor training doesn't technically lengthen anything. What it does is restore the internal blood pressure and fullness that allows the tissue to reach its actual natural size. For men who have experienced years of partial erections, that difference can feel dramatic, and it's legitimate, because your body is finally doing what it's designed to do. There's a neurological layer to this as well. When pelvic floor muscles are properly activated, the brain receives better sensory feedback from the pelvic region. Men often describe this as feeling more connected to their own body, more aware of sensation, more in control of rhythm and timing. Many report increased pleasure during intimacy, and that's not coincidental. It's the direct result of improved communication between the brain, the nerves, and the pelvic musculature. When that system is working the way it should, everything feels sharper, more responsive, more present. There's also a fatigue factor that I want to address. A lot of older men compensate for weak pelvic muscles without realizing it. They over-recruit their abdominal muscles. They hold their breath during intimate moments. These compensatory patterns raise blood pressure, create unnecessary tension, and actually make things worse over time. A well-trained pelvic floor takes that burden off the wrong muscles and puts the work where it belongs, which means less fatigue, more natural movement, and a better overall experience. Let me give you a realistic timeline for what to expect. Weeks 1 and 2, you're building the connection. The contractions may feel weak or uncertain. That's completely normal. You're waking up muscles that haven't been actively trained, possibly ever. Focus on finding the right muscles and holding the contraction cleanly. Progress at this stage is about awareness, not power. Weeks 3 through 5, the effort starts to feel more natural. The muscle activates more easily. You'll notice improved endurance and a growing sense of physical confidence. Some men start to feel subtle improvements in firmness during this window, particularly in the morning. Weeks 6 through 8, coordination improves. Many men report better control and stability during intimate activity. Some notice a reduction in urinary urgency, a bonus benefit that I'll come back to in a moment. The exercises are becoming habit by now, integrated into the day without much thought. Weeks 10 through 12, this is where most men see the clearest changes in firmness, angle, and perceived fullness. If poor venous occlusion was the primary issue, which it is for a large percentage of men experiencing these changes, the improvement at this stage can be quite striking. Not every man will experience the same degree of change, but the research and my clinical experience both suggest that the majority of men who stay consistent reach this point with something meaningful to show for it. I want to be honest with you. Progress isn't always linear. Some weeks will feel better than others. Some days you'll wonder if it's working. That's part of any physical training process. The men who see the best results are the ones who treat this like an athlete treats practice, not obsessing over daily results, but showing up consistently and trusting the process. Now, beyond erectile function, and I want to make sure I say this clearly, pelvic floor training has a broader set of benefits that matter enormously as you get older. Urinary control. Bladder leakage and urgency become more common with age, particularly for men who've had any prostate issues. Strong pelvic floor muscles are your first line of defense against both. Many of my patients who start this program for erectile reasons end up telling me 6 months later that the urinary improvements were just as meaningful. Prostate health and recovery. If you've had a prostatectomy or other prostate-related procedures, pelvic floor rehabilitation is the single most evidence-supported intervention for post-surgical recovery. The sooner you start building that muscle base, even before any issues arise, the better positioned you are to recover faster and more completely. Long-term pelvic stability. The pelvic floor supports your bladder, bowel, and surrounding structures. As we age, that support naturally degrades. Training these muscles now is essentially preventive medicine against a whole category of problems. Incontinence, prolapse risk, chronic pelvic discomfort, that become increasingly common in the decades ahead. So even if intimate function isn't your primary concern right now, this practice is worth doing. It's 3 minutes a day of genuine, compounding investment in your long-term quality of life. Let me address something I hear from men who've tried this before and stopped. They say, I tried Kegels and nothing happened. And when I dig into what they were actually doing, one of a few things is usually true. They weren't isolating the correct muscles. They were tensing their abs or glutes instead. They weren't being consistent enough, or they stopped before the 4 to 6 week mark when real adaptation begins. Pelvic floor training has a learning curve that most other exercises don't. The muscles are internal. You can't see them in a mirror. There's no weight to add to feel progress. It requires patience and a degree of body awareness that takes time to develop. If you tried before and gave up, I'd encourage you to start again. This time with the specific cues I've outlined. Breathe out as you squeeze. Keep the belly soft, hold clean, release fully, 2 to 3 sets of 10, spread through the day. That's the program. And if you want to take it further, talk to a pelvic floor physical therapist. These are licensed professionals who specialize specifically in this muscle group, and they can assess whether you're performing the exercise correctly, identify any asymmetries, and guide you through a more individualized program if needed. It's more common than people think for men, especially in their 50s and 60s, to see a pelvic PT, and there's absolutely no reason to feel awkward about it. These are trained clinicians who do this work every day. I'll also say this, for the men out there who are currently relying on medication, whether that's sildenafil, tadalafil, or anything else, pelvic floor training isn't a replacement unless your physician determines otherwise. These are parallel tools. Medication works on blood vessel dilation. Pelvic floor training works on the structural support system that keeps blood where it needs to be. For many men, using both strategically under medical guidance produces better results than either alone. For men who want to reduce medication dependence over time, strengthening the underlying musculature is exactly the right direction. But have that conversation with your doctor. Speaking of which, everything I share on this channel is educational. It's clinical information grounded in research and professional experience, and I share it because I believe men deserve accurate, shame-free health content. But before you make any changes to your health routine, your supplements, your medications, or your habits, please talk to your own healthcare provider. They know your history. They can individualize the guidance. That's always the right starting point. If this kind of content is useful to you, subscribing helps me reach more men who are quietly dealing with exactly what you're dealing with and don't know where to turn. The goal of this channel is simple. Give you the real information without embarrassment, without hype, without wasting your time. So here's where we are. You came in with a question. The answer is pelvic floor training, specifically targeting the bulbocavernosus and ischiocavernosus muscles through daily Kegel contractions paired with diaphragmatic breathing, done in 2 to 3 sets of 10 reps, held 3 to 5 seconds each for at least 8 to 12 weeks. That's the science. That's what the research supports. That's what I've seen work over and over again in over 2 decades of urological practice. Your body hasn't failed you. These muscles just haven't been trained. And muscles at any age respond to training. 3 minutes a day, that's all it takes to start. And for a lot of men, that's the start of getting themselves back.